Shadowing. Health is a state of complete physical, mental, and social well being, not just the absence of disease or infirmity. And good health is something we strive to achieve, not just individually, but as a community. But if we look around us, our family, friends, and others, we know that health is very variable. For example, in 2016, the life expectancy of a child born in Sierra Leone was 53 years, while in Australia it was 83 years. But even within Australia, the life expectancy of indigenous people is about 10 years lower than that of non-indigenous people. And even within a specific group of people, health can change based on a person's income, level of education, power, or occupation. So why is health so variable? To answer that question, we must understand the factors that influence health. The factors that influence a person's health are called determinants of health. These include who they are, such as age, sex, and genetic makeup, and what they do, as in health behaviors such as smoking, physical activity, alcohol use, and diet. Health is also largely influenced by the conditions in which people are born, grow, live, and work and age, collectively called the social determinants of health. So social determinants of health are shaped by the distribution of money, power, and resources at international, national, and local level. This can lead to health inequities, which is the difference health between different groups of people that is unfair and unavoidable. Let's take a look at the social determinants of health using a framework developed by the World Health Organization. According to this frame, there are two broad groups of health determinants: structural and intermediate. Structural determinants are the social, economic, and political context that people live in. It includes governance, economics, and economic, social, and public policy, and also the social and cultural values placed on health issues. These factors can lead to unequal distribution of material and monetary resources, which can shape a person's socio-economic position. Socio-economic position is characterized by education, occupation, income, gender, race, ethnicity, and social class. Structural determinants of health operate through a set of intermediary and determinants that impact a person's exposure, vulnerability, and outcomes to factors affecting their health. These include material circumstances such as the quality of housing, the financial means to buy healthy food, clothing, and other requirements for health living and work environments. Psychosocial factors like stressful living circumstances, relationships, and social support, behavioral and biological factors. In addition to this, health system determine the type of health care, the quality of it, and how accessible it is. Bridging the structural and intermediary determinants are social cohesion and social capitals. The links between all these determinants are not always linear, but can be complex, interdependent, and interact many different ways to influence health. For example, income can limit opportunity for achieving good health, and conversely, poor health can limit opportunities for people to participate in the workforce. And remember, these determinants can act across the course of a person's life. So, the next time you think about health issues, consider not only who they are and what they do, but also the condition in which they are born, grow, live, work, and age. Because if we understand and act on them, we can build a healthier world for everyone.